Welcome to the Spent the Rent podcast. I am your host, Patty Rose. My guest today from Healthcare for All is Lou Sinniger. Lou, welcome to the show.
Thank you. Pleasant to be here.
Yeah, so I met you at the Black Cultural Celebration at Alton Baker Park, and I saw your booth, and I knew that I was going to do everything I could to get you on the podcast or get someone from the group that you've been working with on the podcast. I have been extremely vocal about my support for universal healthcare, also known as Healthcare for All, Oregon. It's one of my core issues, probably second only to maybe climate change and then getting money out of politics. So a step towards healthcare for all is on the ballot in Oregon. And I wanted to have you on to discuss what that looks like for the voters. So first of all, we're going to talk about Ballot Measure 111. I'm going to read what it is and what it says on the ballot. So it amends the Constitution. The state must assure affordable healthcare access balanced against requirements to fund schools and other essential services. Actually, no. A yes vote supports the amending the state constitution to require that the state ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable healthcare as a fundamental right. So in your words, what does a yes vote do for Oregonians? This is Ballot Measure 111.
Well, Patty, what people have to realize is that the legislators want to find out how important health care is to people. And so they passed this. It's a Senate Joint Resolution 12 to place this before the voters. Is it our concern, our value, our principle that we want for our state and our citizens in the state, the people living here, all residents? Is it our value to make sure that everybody has access to health care? That's what they want to know. And a yes vote will tell the legislators that we totally support it, and will allow them to go ahead then and go forward with a plan on, well, how do we do this?
You know, I've been very vocal. I mean, I've done a lot of episodes about Medicare for all, healthcare for all. There's been different ways to word it and to look at the plans. I was reading, but doing research for this episode about the task force that was put in place by the Oregon legislators, that they're starting behind the scenes to prepare that if this does pass and the voters, like you're saying, tell the legislators that they want to go forward with plans on how healthcare for all can become a thing. There's a task force that's working behind the scenes that's working on how they would implement that. This is not, I want to be clear. I mean, this is really important that we support this ballot measure, but this is not, after this is, if we vote yes and this passes, this is not going to mean that everyone has health care. Let's cover this. I want to really drill this home. This is just like you said, this is telling the legislators that that's the, what the people want and the direction that they want to see the state moving. That's correct.
That's right. That's right.
Go ahead.
We all know, everybody knows that, we have of all the top nations in the world, we spend more and get the worst outcomes than any other nation. Our life expectancy fell from 79, that our average life expectancy from 79 to 76 in the last 3 years.
Wow.
Yeah.
Yeah, and that is an average, and there's so many factors to that. And I've been very vocal on my show about suicide prevention, and that's a big part of it. And then healthcare needs. When I personally I can attest for this in my own personal life that there's been many times, majority of times, where something has been an issue where I've been like, I just can't afford it, and that is a dangerous thing, And I'm a barber, and so I am an independent contractor with one employee myself. And so I don't have health insurance and in the past I've made little enough money that I was able to be eligible for OHP, but that's not a viable way to survive. I mean, it's good. And I super support that program, but we want to expand that, we want to expand that. So now, there are many areas that healthcare costs can limit a family's financial flexibility. Like I had just mentioned, the Oregon Food Bank, who strongly endorsed this measure, has laid out the connection to food insecurity created by healthcare costs for those living in poverty. what are some other equity issues that you see relating to overall healthcare costs?
Well, not only, as you mentioned, people do have health insurance, but they can't afford to use it.
Right.
I mean, the statistics have come out. The pandemic really focused on the fact that communities of color and rural communities are suffering more from the lack of health care than any other part of the population. It's a shame. I mean, 60% of the bankruptcies in Oregon are due to healthcare issues.
Right. And
So we have to do something. And at least by voting for ballot measure 111, we give the legislators the opportunity to figure this out and give us the health care that we deserve. I mean, it'll be the first step towards equity in healthcare.
Right.
The first step.
So now Oregon, I think the number one issue in Oregon is probably houselessness. Becoming a homeowner is becoming harder and harder for many folks to even imagine. Right. One of the major barriers is medical debt, like you had just mentioned. Can you speak on what you've been hearing on the campaign trail from people living with insurmountable medical debt?
Well, I mean, I can go to any meeting and say, do you know anybody who takes less prescription medicines than they should just to save the money so they don't have to spend it? Do you know anybody like that? And people will raise their hand. It's all over the place. I mean, it's an injustice to us.
Absolutely. This is something that I've been very lucky. I mean, there's been programs, and there's so many programs that they're so difficult to navigate. I went to the emergency room one time with it ended up being a muscle strain in my stomach, but I was pretty worried about, I was having a really sharp pain in my stomach. And this is when I was in my early 20s. And I ended up applying through Peace Health or Sacred Heart. It's been many years, but through Bridge Assistance, right? There's these programs that are put in place by hospitals where they kind of just write it off. And there's a certain amount that they can do that. And there's eligibility things and all this different stuff. And I applied for it. And then 7, 8, 9 years later, I get called by collections and they're like, well, you still owe us for this bill. And I'm like, wait a minute. I was covered under this thing. And they're like, well, not this thing, not this one line, and I'm like, what the heck is going on? And I was lucky. And I hate this, but I do chalk this up sometimes to privilege in the way. So I know that these same rules don't apply to everybody. And the woman was like, you know what? You're going to be okay. We'll just put this in the folder. And then after the statute of limitations expires, it'll disappear. And she did that for me, which was amazing. And I was very blessed for that. But that being said, that is a problem, that the amount of paperwork and the amount of, it's just such an confusing thing. And then insurance, I'm taking a new medication. And since in the beginning, you have to take a smaller dose and then the dose ups after a certain amount of time, after 2 weeks. Yeah. And so when they sent it over for my prescription to be filled, I go to the pharmacy. They're like, that's going to be $84. And I'm like, wait a minute, I have insurance. That should be covered. And they're like, yeah, but the insurance company only wants to cover for this dosage, not the bigger one. I'm like, well, that's what the doctor prescribed. It's the same medication. What is the problem? And there's these little things that they want to do, right? And so, and if we can get this more simple, I mean, I just want a simple program that's going to work for more people, Yes. And so it's pretty difficult. Now, what are some of the other things from people while talking about this ballot measure? In favor or against? Yeah, well, in favor. On the campaign trail, what is a common thread that you keep hearing from people?
Oh, I've been tabling, and I'll just hold up the sign in back of me. We have a bumper sticker. I'll just hold that up to people and say, what do you think of this idea? And they go, it's about time. Yeah. That's what they're saying. Everybody wants this. The only ones that don't want it are the health insurance companies and the pharmaceuticals.
Yeah. And why? You've done a lot of events. This isn't a left or right issue. I know that the Democrats are definitely, they're champions of this issue. But that being said, it's pretty universal. But what are some of the opposition that you have heard coming from either the left or right?
We don't have any. There's no organized opposition to it because everybody knows that we have to take a step forward, right?
Yeah.
What one opposition was that, oh, the state will get. I heard one person talk to me about it. Oh, the state will get sued, right? And I'm going, well, it says right in the bill that any suit has to be can't interfere with other public schools and other public safety issues or services.
Right.
And my comeback is, look, anybody can sue anybody for anything. That is not going to break the bank, right?
Sure. Well, and we'll deal with that as it comes. Not that you wouldn't be prepared, but there's a lot of misconceptions and a lot of fears constantly from people. But it's funny. It's like health insurance is such a joke that when there's a program that is being proposed to eliminate it, people don't want to trust it. And I understand. And then this is something that is done in every country. We are falling so far behind on. I worry long term about. Well, not worry. I think that we have to evolve. We have to look forward. We have to think forward. So there's going to be preventative care. That's going to be something that we really need to lean into. And James Barber, who is one of my sponsors for my podcast, he has been extremely vocal about in favor of this issue. He's kind of taken a back seat in the last few years because he worked so tirelessly pushing Bernie Sanders that I think he just was like, you know what, I'm checking out. I mean, it's exhausting. You can attest to this. So, working on the campaign trail, but you guys do a great job. But he talked about mental and dental and how much benefit there is when you can provide someone, healthy teeth and a healthy mind or at least help assist that. Dental is something that is so crucial that as more and more studies come out about how plaque buildup on your teeth can actually get into your heart, can cause heart disease. There's a lot of different things that happen. So it's really, really important. And also just, unfortunately, we are a visual society to where when there's people have issues with their teeth, it can limit your ability to maintain an adequate job and make a living wage.
Yeah.
So
health is for the whole body. Right? Why is it you go to an insurance company and they'll insure you for this, but not for that? They won't insure your eyes. What, you can't see? What if you get macular degeneration or something? Somebody's got to do something about it, right? Your teeth. You have a toothache. Have you ever had a toothache? That's the worst. And if you don't have good teeth, you can't chew your food. There you go. Right. So. We have to take control of this. This is costing us money. Did you know that they did a study in Canada? We have car companies in America, and the same car companies are in Canada. And because they have healthcare for everybody there, those car companies in Canada build those same car for $1,500. This was like 5 years ago, $1,500 less.
Wow.
So that's economic. It would put, if Oregon had healthcare for all, it would put us in the world to be able to trade and sell our services and goods far cheaper. It will save us money and give more.
We just don't want to tell anybody that we're doing it so that where they're at. No. Now, what is, if this measure passed? I want to again read it. This does not grant healthcare. This is the first step. What is it? It does not grant for all, but what it does, a huge leap in that direction. So it passes. What's next?
What's next is that then we give the legislators the job to go ahead and figure out how to do this. They could put everybody on Medicaid, right? But there's problems with that because you don't have a choice of providers, and it costs money. Or they can look into, and they've got a fact-finding task force that gave them final recommendations on how and what is necessary to put in place universal care,
Yeah.
right? And so that's finished. So they'll have that in their hands, and they'll be able to look at that. There's necessary waivers from the federal government to get Medicare and Medicaid dollars and all that. And it's going to be kind of complicated for them to figure out exactly how to pull this out and away from, profit motive health insurance companies and pharmacies, and how to do this. But, the concept is in other countries where they have some sort of universal care, they bargain how much they will pay pharmaceuticals, right?
Right.
And so we're sitting here paying more for pharmaceuticals than any other nation in the world, right? And inside us, though, is called the Veterans Administration, and people that go to the VA, they like the VA, and they pay over 30% less than the commercial market, because they negotiate with the pharmaceuticals how much they'll pay. So there's savings and those recommendations from the task force did not include those savings yet. Even at that, their rough estimate was that we would save $1 billion the first year even.
Wow. So now talking about costs, there's a lot of naysayers to anything, any healthcare for all model, that they say, oh my gosh, this is going to cost so much money. They always neglect to talk about the fact that you will not be paying out of pocket insurance costs.
Right.
They always leave that part out, that it's like, you are going to be paying more taxes. There's no question, but you will not be paying healthcare costs. I guarantee that there will be some type of model where employers can offset because there has to be an employer model, because that is a way that employers keep workers. It's an incentive, those benefits packages that they offer you when you have a good career, that they negotiate with you so that they can keep you, and the best packages are government jobs. There's no question, unless you're talking working for the pharmaceutical company deceitfully, but that's a whole different, where you can make buco bucks, but that's not what we want. We want a livable wage that creates, equity for all, and we want healthcare for all. Now the concern. Go ahead.
I'm glad you mentioned that, because recently, we're suffering here. The Weyerhaeuser employees went out on strike. This happened about a month ago. Okay, this has happened before, right? Everybody's used to that, and they're going out on strike. Why? Because they gave up a lot the last negotiations on healthcare, and the company wants them to give up more. So what happens? They're not only losing wages now, but now, since they've been out on strike so long, they've lost their access to healthcare. Now they cannot use that insurance unless they pay COBRA, which is like $1,500, $1,600 a month, right?
Right.
You're not getting any money in. So it's a double-edged sword.
Right.
And I think it's about time that employers started realizing that they're just passing healthcare costs off to the employees. It's their responsibility to do something about that.
Right. Yeah. And so it'll be interesting to see how that all plays out. We wanted to talk off air. You were talking about a New York Times article that was talking about, the argument that it's like, it's better in the private sector. Well, not necessarily, because you had mentioned a New York Times article that is egregious waste of taxpayer dollars. And can you talk on that a little bit?
Yeah. So the article was, I lost it here. Oh, the cash monster was insatiable. Insurers made billions from Medicare. So what happened years ago? Medicare was a government program, right? And they just paid out. They hired a company. They paid out whatever the doctor charged. They set limits on what they could charge. And so they decided to contract some of that out by creating a Med Advantage plan. Well, the Med Advantage plan was great. They would offer a few more benefits like eyeglasses or a little bit work with teeth and whatnot. And so people started buying into it. Well, what happened was that they weren't getting the care that they needed. So Congress said, well, we'll tell you what, to equal this out, we'll pay you more to take care of those people that really need care, right? So that'll over time will lower our costs. So the insurance companies figured this out. And so now what they're doing is they're over-diagnosing people. And therefore they get more money from the government. Our money, right? They get from the government. So they're not only over-diagnosing them, but they're like, if you had diabetes 2, right? And they up it to diabetes 1. Well, then Medicare will pay them more. And the trouble is, it's in CMS, the Centers for Medicare and Medicaid Services, that part of the organization, of the Medicare organization, is now being run by people that came out of the healthcare industry.
Right, exactly.
Out of the insurance industry.
Yeah.
And so they're not doing anything about it, even though they could. They aren't. So we have to fix that. So just because, it's the private sector that is, as they say, greedy and falsifying records to make more money. And it's all the big companies.
It's just yet another example of where we need accountability that's equal across the board, right? And so when you have people policing themselves, I mean, I've talked about this in public safety. I've talked about this in corporate greed. I mean, it happens in every area that you see, because what happens is people put people in position that we're going to do the things that will keep them in power. And so it's so bad. I mean, and when you, So one more thing I want to talk about before we get out of here, the governor's race. This is going to be really, really big for the future of what happens with healthcare for all. There's no question. I know that as somebody representing Healthcare for All Oregon, you cannot endorse, but I wanted to mention, who has been helping with the campaign. I know that the only person in the race that's fully all in, that it's one of their core values that supports Healthcare for All, is Tina Kotek. When I was at the Black Cultural Celebration where I met you, and among many other people that were just amazing, that was a great day at Alton Baker Park. Tina Kotek was at your booth. I didn't stop and talk to her because she was being surrounded by so many people trying to have FaceTime. But Tina Kotek, and also State Senator James Manning. James Manning was really big, and this is a big issue for him that he's been really pushing. Who are some of the candidates? I know, the Republican is going to get rid of the task force, is going to get rid of, all these different things. I'm not sure if they have that power, but I'm pretty sure they do. They're going to push for that if they win, if Christine Drazen wins, and she's leading the polls right now. Phil Knight has switched his allegiance from Betsy Johnson to Christine Drazen, or really he's funding both of them to make sure that the Democrat doesn't win, And so who have you seen on the campaign trail from local candidates who have been really pushing and been really helpful for this Healthcare for All Oregon? Well,
Tina has done a great job. But my champion is the Senator James Manning.
Yeah.
He helped create and got pushed through Senate Bill 770, which created the task force on universal care. And he has done a tremendous job. And he swears, and he was at the same event where we met. And he swears that with the help of the people, he will get us healthcare for all, right?
Yeah.
It's universal care is so important. One thing that people don't realize is that it's through healthcare, women have a right to healthcare.
Right.
And in this state, we're lucky that so far they have the right to make choices about their own bodies, right? And if we had healthcare for all, that would even bolster that better, because they would have no charge on point of service. They could go to the doctor. discuss what their needs are and where they're at, and make their choices and be covered, right?
Yeah.
So it's very important that people think about this, because it has, if you have universal care, it has far-reaching impacts for the better. I mean, rural communities will get better service, and people in communities of color will get better service. At least we'll start to, with universal care, will at least the costs will not be a barrier.
Yeah, absolutely.
Yeah.
Well, thank you so much. You know, I want to mention one more time just to drill it home. It's Ballot Measure 111. It's an amendment to the Constitution that yes vote supports the amendment. So vote yes on Ballot Measure 111. It amends the Constitution to require that the state ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable healthcare as a fundamental right.
Right.
So that is exactly what it says. I'm strongly supporting this measure, Ballot Measure 111. I will be voting yes. So from Healthcare for All Oregon, Lou Sinniger. Lou, thank you so much for coming on the Spent the Rent podcast.
Thank you.
Yeah,
All
and
right.
if you're listening at home and you'd like to support the podcast, you can go to STRPOD.com and click on the donate link, and there's a few different options of whatever you're more comfortable with. You can make a donation as small as $5. You can become a monthly sponsor that can help me continue to grow and spotlight stories like this. So thank you all so much for listening.